Assalamu alaikum. I am Dr. K.M. Julfikar Hasan, lecturer, Department of Pathology, Boshundhara Addin Medical College. Today I will discuss about the topics of neoplasia. Now, what is neoplasia? Definition of neoplasia is a neoplasm is an abnormal mass of tissue, the growth of which exceeds and is uncoordinated with that of normal tissues and persists in the same excessive manner after the cessation of stimuli which evoke the changes. What are the types of neoplasia? Neoplasia is two types, one is benign and another is malignant. What are the difference between benign and malignant neoplasia? Benign neoplasia is well differentiated, on the other hand malignant is anaplastic. Orientation of neoplastic cells, benign is not disturbed but malignant is disturbed. Nucleus, in case of benign is little altered, mitotic figures are few normal. In case of malignant, hyperchromatic and pleomorphic nucleus. Pleomorphic means variation in size and shape of the cell. Nucleus are usually numerous and abnormal. What is the nucleus and cytoplasm ratio? In case of benign, normal. In case of malignant tumor, that is 1:1, increased. Normal case 1:4 or 1:6, nucleus and cytoplasm ratio. Rate of growth, grow and expand slowly over years. In case of benign tumor, malignant tumor grows rapidly and is progressive. Size, a small size in case of benign tumor and large size in case of malignant tumor. Stroma well formed and poorly formed in malignant tumor. Hemorrhage and necrosis more common in malignant tumor and little tendency in benign tumor. Capsule, in case of benign tumor encapsulated and malignant tumor not capsulated. Most important difference is metastasis and local invasion. Metastasis occurs in malignant tumor, frequently occurs in malignant tumor but never occurs in benign tumor. Local invasion, benign tumor remains localized but local invasion and infiltration occurs in malignant tumor. Now, what is dysplasia? What is anaplasia? Dysplasia means disordered growth and anaplasia means degree of differentiation is called anaplasia. Dysplasia is disordered growth. It is characterized by a constellation of changes that include a loss of the uniformity of the individual cells as well as loss in their architectural orientation. It occurs more in epithelia. It is the precursor of cancer. What are the characteristics of dysplastic cell? Pleomorphism of the cells, that means variation in size and shape of the cells. Hyperchromatic nuclei, it is the characteristic of dysplastic cell because cell division does not occur. So, DNA content increase in nucleus. So, it shows hyperchromatic nucleus. Nucleus cytoplasm ratio high in case of dysplastic cell. Normal ratio is 1:4 or 1:6. Here we can see 1:1. Nucleus shape variable. Chromatin looks coarsely clamped and distributed along the nuclear membrane. Mitotic figures are more abundant than usual. Nuclei are size and number are increased, mitosis increased in malignancy. How can we differentiate dysplasia versus cancer? Dysplasia is lack of invasiveness, reversibility and mitosis, number increased in malignancy. That means lack of invasiveness in dysplasia, reversibility can occurs and mitosis occurs. Dysplasia may progress to cancer. it is reversible as basement membrane intact. Dysplasia is reversible as basement membrane is intact. Sites of dysplasia. What are the common sites of dysplasia? Dysplasia is commonly occurs in squamous and transitional epithelium, like as cervix of the uterus, respiratory tract in chronic cigarette smokers, urinary bladder, larynx, skin, oral mucosa, that are the sites of dysplasia. Now, carcinoma in situ. When dysplastic changes are marked and involve the full thickness of the epithelium, but the lesion does not penetrate the basement membrane, it is called carcinoma in situ. It is considered a pre-invasive neoplasm. Once breaches the basement membrane, the tumor is said to be invasive. Now, most important topics is nomenclature of neoplasia. On the basis of tissue origin, tumor of mesenchymal origin, benign tumors are fibroma, lipoma, chondroma and osteoma. These are connective tissue derivatives. On the other hand, malignant tumor is fibrosarcoma, liposarcoma, chondrosarcoma, osteogenic sarcoma. Vessels and surface coverings. Blood vessels tumors is benign is hemangioma and malignant is angiosarcoma. Lymph vessels lymphangioma benign and malignant is lymphangiosarcoma. Mesothelium mesothelioma benign and benign fibers tumor is benign. Brain covering meningioma benign tumor and invasive meningioma malignant tumor. Blood cells and related cell types, hematopoietic cells, leukemias and lymphoid cells, lymphomas. These are malignant tumor. Here benign is absent. Muscle cell tumor, smooth muscle tumor, benign tumor is leiomyoma and malignant is smooth muscle leiomyosarcoma. Striated tumor rhabdomyosarcoma and malignant is rhabdomyosarcoma. Tumors of epithelial origin. Stratified squamous origin, like as squamous cell papilloma and squamous cell carcinoma, it is malignant. Basal cells skin or adnexa, basal cell carcinoma, it is malignant tumor. Melanocyte nevus is benign and malignant melanoma is malignant tumor. Epithelial lining of the glands or ducts, like as benign adenoma, papilloma, cystadenoma, and on the other hand malignant is adenocarcinoma, papillary carcinoma, cystadenocarcinoma. Respiratory passages, bronchial adenoma and bronchogenic carcinoma. Renal epithelium tumor, renal tubular adenoma, renal cell carcinoma. Liver cells tumor benign is hepatic adenoma and hepatocellular carcinoma is malignant. Urinary tract tumor is transitional cell papilloma and transitional cell carcinoma. Placental epithelium is malignant is choriocarcinoma and benign is hydatid from mole. Testicular epithelium malignant tumor is seminoma, embryonal carcinoma. More than one neoplastic cell type mixed tumor usually derived from one germ cell layer. Salivary tumor benign is pleomorphic adenoma and malignant mixed tumor of salivary gland origin, it is malignant tumor. Williams tumor, renal angles tumor, Williams tumor, it occurs in case of children, it is malignant tumor, Williams tumor. More than one neoplastic cell type derived from more than one germ cell layer, teratogenous. Totipotent cells in gonads or totipotent cells, benign tumor is mature teratoma, dermoid cyst, or malignant in immature teratoma, teratocarcinoma. What is totipotent cell? When involve all cell germ layer, ectoderm, mesoderm, endoderm plus extraembryonic cell, then damage all the cell type, then it is called totipotent. What is multipotent? What is unipotent? Multipotent means two embryonic, ectoderm or endoderm, and unipotent means one embryonic cell layer is involved, that is or ectoderm or endoderm or mesoderm. Now, I am showing you difference between sarcoma and carcinoma. Carcinoma, malignant tumor of epithelial cells, age involved around 50 years. It is common, carcinoma tumor is common. It is slow growing tumor, cell arranged in groups or columns. Stroma is often well formed, blood vessels are not numerous. Lymphatic spread is common. In case of carcinoma, lymphatic spread is common, but in case of sarcoma, blood spreads occurs here. Sarcoma, it is malignant tumor of mesenchymal origin. It occurs in first and second decades, but can occur in all ages. Sarcoma is uncommon. Sarcoma rapidly growing, arranged in diffuse sheets, poorly formed and separate cells. Blood vessels are numerous and blood spreads occurs. This is the difference between sarcoma and carcinoma. Now, what is the locally malignant tumors? These show invasion but no metastasis. Locally malignant tumors shows invasion but no metastasis. It may be benign. Importance examples are most important in locally malignant tumors. Number 1, basal cell carcinoma, giant cell tumor, amyloblastoma, craniopharyngioma, carcinoid tumor, gliomas, astrocytoma, oligodendroma, ependyma. Then Marjolin's ulcer also is a locally malignant tumors. Now, paraneoplastic syndrome, symptoms and signs that cannot readily be explained by the anatomical distribution of the tumor or by the elaboration of hormones indigenous to the tissue from which the tumor arose. This box is collected from the Robbins pathology. Clinical syndrome, endocrinopathies, Cushing syndrome, major form of underlying cancer, Cushing syndrome, major forms of underlying cancer, small cell carcinoma of the lung, pancreatic carcinoma, neural tumors, syndrome of inappropriate antidiuretic hormone secretion, small cell carcinoma of the lung, intracranial neoplasm, hypercalcemia, squamous cell carcinoma of lung, breast carcinoma, renal carcinoma, adult T cell leukemia বা lymphoma, hypoglycemia, ovarian carcinoma, fibrosarcoma, other mesenchymal sarcomas, polycythemia, renal carcinoma, cerebral hemangioma, hepatocellular carcinoma, osteomalacia, postaturic mesenchymal tumor. Now, I am showing you grading of the tumor. What is grading? What is staging? Grading, it is based on the degree of differentiation of the tumor cells, and in some cases cancer, the number of mitosis or architectural feature. It is based on degree of differentiation of the tumor cell, determined by the cytological appearance. Grading determined by the cytological appearance. It is the measure of degree of malignancy or aggressiveness. Grading classification, grade 1, grade 2, grade 3, grade 4. Grade 1 is more than 75% cell is differentiated. Grade 2, 50 to 75% cell differentiation. Grade 3, 25 to 50% cell differentiation. Grade 4, less than 25% cell differentiation. Now, what is staging? It is based on the size of the primary lesion, its extent of spread to regional lymph node, and the presence or absence blood-borne metastasis. It is seen clinically. Staging is seen clinically. More important clinical value than grading. Staging procedure, 3 types: UICC, TNM system, AJC system. TNM system, T for Size of the primary tumor. T0 means carcinoma in situ, it is pre-invasive. T1, T2, T3, T4 increasing in size when T4. N stands for the regional lymph node involvement. N0 means no node involvement. N1, N2, N3. N3 means involvement lymph node is more. M for metastasis. M0 means no metastasis. M1 means metastasis present. Today is all about. Thank you everyone listening me carefully.